the main international gateway to the country, Entebbe was one of the earliest places to feel the effect of COVID-19. Safety measures at the airport were tightened, and travelers returning from high-risk countries were subjected to mandatory quarantine for 14 days. Mandatory quarantine was soon made compulsory for all travelers entering the country, and on Monday 21st, 2020, news broke that one of the quarantined travelers had tested positive to COVID-19. According to Dr. Chris Nsereko, the news created worry and panic among the health workers at Entebbe Hospital, where the indexed case was taken for treatment.
Even the health workers didn't know what to do. They didn't know what to do. How does this disease, which is the treatment? So we would just see on TV, on international media, people dying.
What was the reaction like when your family heard that you are at the forefront of treating COVID here at Entebbe Regional Referral Hospital?
Our families face stigma. We didn't them to be stigmatized more in the community, because when you go home, actually everyone where I live, they knew that that is the wife of the doctor who's treating COVID. So even I told my wife and children to make sure they only move when it's a bit necessary.
Nsereko says health workers at first hesitated to attend to the patient, and as a team leader, he felt he had to be exemplary.
So I had to be at the forefront, you know, to put, it's like the common saying, they say, I had to make sure that, you know, I sacrifice all.
Nsereko says once it was reported that the first case was receiving treatment at Entebbe Hospital, members of the public started avoiding the health workers and their families. People even did not want to walk in front of the hospital. The medical workers would eventually start staying at the hospital, and they did not go home for nearly 5 months. As cases increased, the patient's behavior became problematic, and the military was called to guard the area. Some health workers were infected, and this affected the morale at the hospital.
Thought about dying. I know maybe probably I would die as I try to fight this disease.
A prayer space was set up, and this offered some solace for the distressed health workers.
In the darkness, my girl, that is who you are.
Another trying moment was when one of the patients had to deliver a baby.
How are we going to maintain the sterility and make sure that this mother, even after operation, doesn't get infected? That was, I think, for the Entebbe team, that was our greatest test.
When the first patient was discharged, the health workers began to feel that their efforts had not been in vain. Some people like Semi Sivira volunteered their time to help out around the hospital. Over 1,500 patients have been treated at the hospital, and Dr. Nsereko believes his health workers have every reason to celebrate.
One is to thank them so much for the great work and their sacrifice for others, but for the fellow Ugandans.
Nsereko says Ugandans should remember that COVID-19 exists, and it is necessary to adhere to the prescribed preventive behavior and get vaccinated if they are eligible. With the facility that was once full to capacity with the COVID-19 patients and now marking a year without any is an achievement, according to the frontline health workers. We are told the last patient was discharged yesterday, and there are plans to now open the facility to the general public. Carman Ivan Walunyolo, NTV Weekend Edition.